Hi guys.
Hello everyone.
Hello.
This is Khushbu.
This is Keshav.
I hope that you all know us by now. We are Dr.
Two medical students currently studying in Ukraine. Yes.
And running this vlog, Dr. Behind the Scenes.
So this time we are going live with
Road to UK.
Road to UK. Yes. So this live will mostly cover all the paths of pathway to UK. It includes all the ways and all the resources we can use.
Hello.
Hello.
Hello, doctors.
How y'all doing?
How are you?
Good, how are you? Just gonna adjust.
We are
good.
also
We are
good.
good.
We are also good. It's so nice to have you on board and taking out time to talk to your juniors who are aspiring to come to UK.
What I want to ask is, like, there are many routes to go to UK, right? It can be Plab, it can be MRCS. So, which route you chose?
We both took Plab route because we thought that we came to the UK just finishing internship back home. There was, if we had to prepare for a postgraduate exam and all the other stuff, we'd have to invest more time and then come, because with the postgraduate exams, you have to finish all parts and finish, like, if you want to do MRCS, you have to finish both parts. If you want to do MRCP, you have to finish all three parts. And that will take a lot of time and effort to finish those. So our target was to come to this country as soon as possible, and then gain experience and learning points and do the post-graduation exams as in we do training. So we took Plab route because Plab is by far, I think, the quickest and I think less expensive than the other ones as well. So yeah, we both took Plab exams, and I suggest if you are if you intend on making a career in the long run, making a career in the UK for the long run, then taking Plab exams would be the best option for early in the career.
Okay.
So, as you said that for non-UK residents, Plab is the easier route and we can reach UK faster. But there are other exams also. So let's go deeper and talk about other exams, other routes for different people and different scenarios.
Sure. Yeah.
Right.
So
So let's start with Plab.
yeah.
Okay.
Right.
Okay. So Plab. So I would say if you are a medical graduate or still a medical student and you are really inclined to come and work in the UK and you want to start as early in your career as well, taking the Plab exams is the I think the most advised route, because Plab can be taken right after your medical degree. To take Plab exams, you don't even have to finish internship anywhere else. So you can take Plab exams. But if you finish internship in anywhere as an approved pattern of internship, you don't have to do UK's internship. To get GMC registration, using your internship back home, you can apply for full GMC registration and basically start off working as a registered doctor in the UK. But if you're like, no, I want to do internship in the UK and I don't have the option where else, then you can actually apply for UK's internship after taking Plab exams. But that actually requires a very meticulous timing, because as internship in the UK is a training, so they have a set time that's open for application. It's called United Kingdom Foundation Program Organization, which is in short called UKFPO. So if you want to join UKFPO Foundation training, which is 2 years, you have to have Plab done and their clinical assessment and SJT, I think that's started situational judgment test. So they're like, I think 3 or 4, I think 2 more extra tests to be done apart from Plab to join the UK's internship. So that only applies to people who don't have done any internship back home or just graduate from medical school and do not want to do internship elsewhere and start in the UK from day one and 0 point. So they have to think about doing a United Kingdom Foundation program, which is UKFP, which is a 2 years program. So in this 2 years program, after the first year, you get full GMC registration. So initially with the Plabs, you apply for provisional, which is given to you for 2 years, I think 3 years, but within the 3 years. After doing Plab 2, both Plabs, if you have, so you'd say you completed Plab exams, Plab 1 and 2. Now you want to apply for registration. So what kind of registration you can apply for? So basically two types of registration. One is provisional and another is full. So you can only apply for full if you have done internship, which is acceptable by GMC.
Yeah.
So if you have not, you don't have any internship, or you have not done anything after graduation, you can only apply for provisional. So when you apply for provisional GMC registration, you cannot just start working in the UK like a registered doctor. You can only apply then for United Kingdom Foundation Program, which is UK's internship. So there are two distinct pathways. If you have done internship and you have not done internship. If you have done internship elsewhere and it is accepted by GMC, then you can take Plab and apply for full registration and work as a doctor in the UK like a registered doctor. But if you have not done internship, you can take Plabs and apply for provisional registration and join UK's internship.
Okay. So according to you guys, which is better, doing internship like we are from India and doing our MBBS in Ukraine. So what is better, to do the internship first in India, 1 year internship, then go for Plab, or directly go to the Plab? Go for Plab and do internship?
I think it depends on what you want to do in you have to be, I would say, a bit adult and think about in the future as well. What's your chances of going back to India and practicing? Because if you burn that bridge and never do internship in India, there is unlikely there might be some registration. I cannot say about India, but for my country, if nobody does a registration or internship in Bangladesh, they can never go back and work as a doctor. They'll have to do internship again. So if that's the thing, think about whether you want to work in your country ever. Then probably I think doing an internship back home and have a registration back home gives you something to go back to if you have the intention to. But if you're like, no, I don't want to go back to India ever, or I don't want to go back to my home country, I graduated from somewhere else and I will go to England to further my career, then you can go for directly UK's internship. I think it all depends upon what your circumstances are. But I'd say that if you ever have the intention to go back to your home country and be a doctor, doing internship there makes more sense.
Okay.
Yeah, wouldn't you agree?
I mean, yeah, it's just dependent. I know a lot of people don't want to go back to their countries because then if they've already graduated outside, because then they have to take their country's licensing exam, which is like another exam anyway. So some people say that, well, why take that exam? I can just go abroad. Or if some countries do accept the UK's training program, and then you can go practice back in your home country, then you don't have to worry about internship. But that's only if that's true for your situation. I mean, depending on what country you're coming from, it may vary, like Ibrahim said. But if it's something that you have to worry about and you think...
It's really difficult to comment because, say, for India's medical council, it's not, I think MCA has been devolved into state medical councils as well.
Yeah.
So whether that state medical council will entirely accept your UK's training, it's difficult to say. And forget India, maybe in other countries, people graduate from other, whether each individual medical council will accept UK's entire training as a specialist training, it's impossible for us to know. So I think it's the doctor's responsibility to know whether my medical council will actually recognize entire UK's training. If they do, and I know that they will, then possibly going straight to England is not a bad idea at all.
So this United Kingdom Foundation program, does this also add into our expenses, or are we getting paid for the internship that we are doing there? And will it suffice our living there?
So you'll be paid as per the same rate as the basic pay for an FY1 or FY2 doctorate. And then on top of that, whatever on-calls you have. Because it is an internship, it's rotational, as many of you will have in your own countries. So you will see when you get the listing of which medical colleges or which hospitals will be willing to take you. They'll say what type of rotations you have for those 2 years. So let's say, for instance, you'll have a couple of 4 months in psychiatry, 4 months in geriatrics, 4 months in trauma and orthopedics, and that'll make up your 2 years. And because all of those specialities will have different working hours, different on-call demands, that will have a different additional pay on top, but the basic pay will stay the same. And we know some individuals actually who have been international graduates who've entered into UKFPO, and they haven't had any issues when it comes to living or paying for things. A lot of hospitals also, if they offer hospital accommodations, they have preferential seats for new F1s, the new interns, so that they stay on hospital accommodation for the first year. which is, I mean, they're still going to pay, but it'll be considerably less than if they were paying on their own.
So, I mean, if the question is whether it's livable in the UK with an F1 and F2 salary, it is, I would say.
Yeah.
Okay.
And like this will clear a lot of doubts, but now coming to the Plab proper exam, what is the right time to start the exam and how much time it will take to study? And is it good to start in med school, like during this 4 or 5, 6 years during MBBS? Is it good to start preparation, or should we do after completing the med school?
So if any of you all will be graduating by 2024, Plab will be replaced by UKMLA. So that's the first thing to keep in mind, because things will change in that much time. But if you're within your last year to internship, you can think about at least IELTS or OET preparing for the English proficiency exams, because without those exams, you can't even think about taking Plab 1. Now, after that, if let's imagine now Corona is completely gone and all the things have returned to normal, you should ideally think about Plab 1 during your internship. Many countries now have overseas centers for Plab 1, and they're taking Plab 1 fairly regularly. So you can think about doing Plab 1 during your internship. I wouldn't recommend doing Plab 2 during your internship because it would cause a gap in your internship, which, although you can explain, is an unnecessary stress to go and explain, because GMC will be like, why didn't you just wait till you finished your internship and took the exam? So I would say the ideal time, if you think final year to internship, IELTS OET, because it has a 2-year validity, and in those 2 years, if you can clear Plab 1 and Plab 2, you can get your GMC registration. And thinking about it, if you finish internship and then 6 months after internship you clear Plab 2, you could have GMC registration easily within a year of completing your internship.
And preparation-wise, I want to say that why Plab 1 preparation is not necessary in your medical school years, because most of these exams are based on multiple choice questions. So it's nothing. I mean, I would say when you're in med school, be 100% concentrated on the syllabus that you're studying. Devote your 100% to passing the degree first. And after you get that done, preparing for Plab 1, I would say it would not take more than 2 to 3 months, because you just have to go through some question banks. And if you have freshly graduated from a medical school, a lot of things are already fresh in your mind. And going through the question bank and reading the reference books like Oxford Handbook of Clinical Medicine and Oxford Handbook of Clinical Specialties, if you're as a medical student, as a final year medical student, I think you can just keep in slightly touch with the Oxford Handbook of Clinical Medicine. I think that obviously will give you a confidence again when you start preparing for Plab exams. So that's the advice about preparing for Plab 1. And for Plab 2, I think the whole preparation comes after you have come to the UK. Many people join academies and all the other stuff. But the crux of the point is, if you have taken OSCE type exams in your medical school, I think which you have, because the medical study is like that, doing stations, talking to fake patients and taking histories and doing stuff to dummies and all the other stuff. If you have done that, up to exam is nothing different. The only thing that have to know for Plab 2 is basically the marking domain. How do they evaluate you? If you know that well, then you can actually do without going to any courses or anything. So you just have to read on different topics about what is the law of some DVLA laws, some stations ethical situations.
I mean, medicine's the same. If somebody has a tummy ache, you're gonna know which differentials to think about. The things that I think most of us get confused about is, first of all, sometimes we have a hard time understanding accents. They do put in people with a lot of different accents in the exam. Sometimes we're stressed about our own accent and will they understand what we're saying, and our own fluency in English. And then on top of that, about the ethical scenarios and the legality of issues related to things like what kind of medications can be prescribed. Can a child say they don't want a treatment? Is that legal in this country for a parent to say, no, my child must have this treatment? Those are the things, confidentiality. And all of these things actually can be found on the GMC website. Like if somebody didn't want to prepare by going to an academy, if they actually go to the GMC's blueprint and find all the information that GMC has, hard work, yes, but possible.
So basically the course has made that hard work possible for you. They have done the hard work and they teach you those things which are already available on GMC's good medical practice guidance. So that's Plab 1 and Plab 2.
And what about the resources? Like you mentioned that there are some books, you said Oxford handbook. And then what about Plabable? All of these, what do I say,
Question bank.
resources?
So the
Yeah,
question bank
Q-Bank.
that we use Dr. Khalid's 1700s. Some people still use it, some people don't. I found when we used the question bank, I didn't use the question bank as a memorize these questions and these questions will come again. I did it more, these are the types of questions and I should know these topics. So like for instance, if one of the questions was, the answer was, let's say duodenal atresia, then in the Oxford handbook, I would look up what is duodenal atresia and what are the
Right.
important ways to treat it. That's how I took the
Okay.
exam. I know some people only do the question banks
And try to
and
memorize
try to memorize it. I don't think that's a good idea. Whatever question bank you use, I think all the question banks are pretty much the same, to be honest.
Because the medicine is the
If the
same.
medicine is the same, yes. GMC also has a blueprint of their Plab 1 questions and their Plab 1 topics. So if you were to do it that way, do some question banks, look at those topics, and whatever topic you don't have any idea on, you should read about those topics, not just look at
So
the
I
question
think
banks.
whichever question bank you choose, the method of preparation is the key. Because if you choose, say, whichever question bank you thought that this is affordable and I can, or I have like heard good things about it, and you chose it. So the method would be that you see the question, you answer the question. If you got the answer wrong, then you mark it. If you got the answer right and you like, I'm quite confident, just skip it, next question. If you got the answer right, skip it, next question. So this way, if you do like 2,000 questions, you'll possibly mark 800, or say maybe if you're like, not that good, you'll mark maybe 1,500. So after the second revision, just do only the marked ones. So in those marked ones, you'll be like, okay, this topic, I'm not quite sure. Why am I missing the second time? Let's open the book and find out what's about it. Then mark it again. Then when your third revision, you'll be just doing probably 1/3 of the whole question. So reinforcing how you study also helps. I think that's the way of solving a question bank. Utilize the option of marking the question and redoing only the marked question only.
Okay, thank you so much for this. So we have talked about Plab and MRCS and about the resources also in Plab that we can use, and we also talked about the time that one can take. So this is like something very specific to a lot of foreign medical graduates from Ukraine, Russia, and a lot of other Kazakhstan, a lot of other countries. They do not have that much clinical exposure in their MBBS level. They focus more on theory. The college focus more on theory part, and the clinical experience is like 10%, 15%, 20%. So I would like to ask, in that scenario, what should be the approach for Plab 2?
So in that situation, as much as possible, you will need to learn how they approach patients in the UK. There are a lot of books about it, like the Oxford Handbook also has information about foundation programs, how to talk to patients. And there are clinical examination books that the UK, they use in the medical schools here, like McLeod's, which is very good. That will be a step-by-step. If you check on YouTube, a lot of the actual universities even have for prep for their OSCEs, for the final medical year students, how to approach a patient. And of course, the GMC's good practice will tell you how you should talk to and be with the patients. They don't, when you see the rubric for Plab 2, they're not very, very stressed that you have a perfect examination, that you come to a perfect diagnosis. What they want to see is when you talk to the patient, are you talking to the patient the way you should be taking history from a patient? Are you asking them the relevant questions? They want to make sure that you know how to get from point A to point B. To get to point D, when you get to the diagnosis, that's not actually something they're very concerned about. Even as doctors in the hospital, if you're starting out, you don't need to have the perfect diagnosis even when you're an intern. You will speak to your senior will then discuss with you, is this appropriate, should we do this next step? So that's really what the Plab 2 exam is about. You could have a completely wrong diagnosis, but if you approach the patient appropriately, they will take that into consideration. Likewise, you could get the right diagnosis, but you got to that diagnosis in a really, really brash way. Maybe you didn't listen to the patient, or you did a very quick examination, and they won't pass you on that station.
So it's as I said earlier, to actually identify for Plab 2 is the key of the domains that they do marking on. So Plab 2, to tell you shortly, is actually 3 big domains that they put the markings on, and I think each station has the potential to get 12, right? Yeah. So 4, 4, and 4, and they categorize, like, if you're really bad, then give you 0. Then if you're just up to, they give you 1 in that domain. So I think that if I remember correctly, the domains are interpersonal skills, that's one domain. And I think
History taking.
history taking and
then-
data gathering
and then
is one
management.
domain, and management is another domain.
So this
So
management, sorry, I was going to say this. When it says management, it doesn't mean that, oh, patient has a stomach ache, do I give them,
This medication.
this medication?
No.
Sometimes that management is management of expectations. So if the patient says, doctor, does that mean I'm going to die? And you tell them yes. So you see, you've not managed their expectations very well. So it's the whole holistic management. It's not just medicine management. Sorry, go ahead.
So you see, if one person, and the pass mark of a station is determined by how other people did in the station. So if a station in Plab 2 exam is like completely new and nobody know about it, you have the potential to pass the station if you're a really good doctor in a like in a basic sense. If you try and memorize the Plab 2 stations from the academies and all the other stuff, and there's a big potential to fail, because what you will think that I don't know what to ask because this station is completely new. And I have had this with many of my colleagues who are like, this is a completely new station, I got 12 in it. Because they forgot everything and they're like, I need to find out what's wrong with this patient and I need to manage it because I have no idea what's going on. And that's the stations that I also passed a station which was completely new, and I did really well in that because I was like, okay, this is not a common station, so I don't know what the station is like, about. So let's just ask the question and try to find out. And those stations you did really well because that's what they want. If you're gathering the data well, if you have that urge that I have no idea what this is and I want to know, do you have this pain? If the pain goes there, we all know how to take history. So basically, practicing with your colleagues when you're preparing for Plab 2 to speak fluently to the patients and have a method of gathering the data, that's data gathering, done, and have a method of providing management, like, asking people's concerns, like what do they think that is, if they want any medication for the pain right now. Those are the type of questions in the station. If you ask, there's the patient is like, oh, I have a chest pain. And you asking them questions, but you're not asking whether they need anything for the pain. That means you're not doing that well in the management. And non-verbal communication, like we guys are doing, like we're talking, we're nodding, we're listening, we have that non-verbal communication happening. So that also is a part of interpersonal skills. So you see, all these points, one is data gathering, second one is management, and third one is interpersonal skills. So if you do a combination of all of this well, you're passing the Plab 2 station. So even if you don't have good clinical experience when you're in medical school, if you know these things, you can do well.
I think we have covered a lot of things on Plab and different scenarios, but we should move on to this next another route, and that is MRC. I mean, postgrad exams and degrees. So there are two kind of people who, three kind actually, I would like to say. Some people planning directly going from MBBS to directly applying to MRCS. And second, those who have completed their postgrad in their home country and then trying to do MRCS. And third is people who have cleared Plab 1 exams and then they are trying to do MRCS. So let's go. Let's dig in.
With the postgraduate qualifications, there are two types of postgraduate qualifications, broadly speaking, that GMC looks at. There are the UK postgraduate qualifications like MRCP, MRCS, MRCPCH, and then there are overseas qualifications that they also will consider. GMC has a list of those qualifications. They are very volatile. They change and allow different things on different days. So it's a very good idea for you to check yourself. If your overseas qualifications already accepted, then you don't need to take any more exams. Now, if you're an individual who's like, no, I've finished my medical school and I want to do a postgraduate exam, no, for certain exams like MRCP, you need to have 1 year of experience before you can take part 1. So you'd need to complete internship and then you can take part 1. And then other exams like MRCS, you could actually still take. So if you plan for that, you have to also think about how difficult it would be to consider all parts of those exams with the amount of experience that you have. Because these are postgraduate exams, while they aren't necessarily there with like hard and fast rules that you have to have so much experience, it does help to have that much experience because then, especially like MRCP, which has PACES, which is an OSCE-based assessment of patients, seeing them in a clinical setting. If basically it's just down to if you want to go through do you have the experience, do you have the time, and do you have the money at an MBBS level to do it, then by all
Right.
means go for it. If you think, well, I've already completed some of my postgraduate training in my country, if you completed your postgraduate training and it's not an overseas acceptable qualification that the GMC will take, but you have no career gaps, you can think of something like the Medical Training Initiative, which will give you registration as a sponsored doctor, and you would work in a training program for about 2 years in different specialties through the Royal College. So for instance, if you wanted to do an MTI program in neurosurgery, so you would approach the Royal College of Surgeons, show them your qualifications, and if you meet the criteria to apply, they will sponsor you for GMC registration without you having taken MRCS. You don't necessarily need
Okay.
that. They will take other
Okay.
postgraduate exams and other postgraduate qualifications into consideration.
So that's a different pathway. So broadly speaking, GMC registration can be obtained in three pathways. One is Plab exams, one is postgraduate qualification, which Breeze just said that there are two types. One is UK, one is overseas. And the third one is sponsored pathway, which is run by Academy of Medical Royal Colleges, which is titled as Medical Training Initiative. So you can get lasting GMC registration. That's not only for 2 years. You'll have a lifelong GMC registration, but you'll be sponsored for only 2 years of work. So if you want to work further, then you'll have to find your job and get visa and other ways. But you will get the GMC registration for life. So yes, if just to take away from what you said, MRCP or MRCS, a lot of people think that passing an exam means I have that competency. It's actually not like that in the UK. You have to work
Okay.
to get the competency. Just because you sat at home, did some courses, and passed MRCS doesn't mean that you have gained the competency to become a surgeon. It's not like that.
Okay.
So you have to have the working experience as well. So if you have not done anything since internship and you just passed the MRCS exam, probably you don't hold to that much of a higher category in the UK, because in the UK, they think that a doctor should be in training and completing these exams alongside. So like for MRCP, they want the core medical trainees to do the MRCP. That means MRCP is not the priority, rather training is the priority.
Training.
So if you are a trainee and you pass the MRCP exams, that means you are actually climbing the ladder. But if you're not working at all and you're just passing the exams, you're not doing much. So exams are a complementary to part of your clinical work. So even if you pass MRCS and you have not done zero clinical work, you've just passed the exams, you basically are the same as like a foundation training. So you have to have that working experience to advance. So just passing the exam doesn't mean that I'll be allowed to join higher training just because I pass an exams. No. To join higher training, you have to have a clinical experience of lower training first. So whatever way you are doing right now, you have to be involved in clinical work to supplement these membership exams or post-graduation exams.
Okay. That was a real insight to this. Thank you, Dr. Ibrahim. So we have talked about this Plab. After students giving Plab 1, can they give MRCS? And because say that they have internship for 1 year and then they give Plab 1, can they now go to UK and do their, I mean, go and work there and then give MRCS, or do they have to wait till Plab 2 and then go to UK and
So-
then give? Yeah.
So to start working as a doctor, you have to have GMC registration first. So with only Plab 1, you cannot get GMC registration. So you have to complete Plab 2, you have to obtain GMC registration, and only then you can come to you can work as a doctor. And while working as a doctor, you can do whatever you want.
You can take as many
You
exams as
can
you want.
you can dance in the street, or you can you can take exams or anything. But before coming to work in the UK, you have to have GMC registration. And for that GMC registration, you have to complete either the whole Plab or you have to complete the whole MRCS. So whichever you want to take first. So if you like, I want to take Plab first, I want to go join in the UK workforce. And with the experience of working there, I'll take my post-graduation exams when I fit or when I see fit. So you can do that as well. But you cannot just pass MRCP Part 1 and come to the UK. on what basis you will get GMC registration. You don't have that. So you have to complete the Plab and then get GMC registration, come to the UK, and then take your career forward.
Okay.
I think we covered Plab and MRCS. I just want to ask one thing about UKMLA. Like, it's gonna same like USMLE, or it will
So
be
the
same
information right now, so far that GMC's provided related to the UKMLA is that the first part of the exam will be computer-based instead of a written exam, which is what the USMLA already is. The second part, they've still said, will be exactly the same. It'll be an OSCE setup. The real big difference is, just like the USMLA, they will make their UK graduates also pass the UKMLA before they can proceed. So I know a lot of us will have finals exams or professional exams, but we don't actually have a very end exam that we have to pass in order to, get our registration. But they're going to put that into place here in the United Kingdom.
Okay.
I think in a way, I know a lot of people are scared because they're like, well, what can they ask? Will it be very difficult? But I think actually it may make things easier because there is a potential when you come to work in the United Kingdom through Plab that people will be like, oh, that must have been a very easy.
So yes, it will be different. So I think as human beings, we are fearful of unknown. So, but what we know that Plab, UK, it's the UKMLA, United Kingdom Medical Licensing Assessment. It will be two parts like it is right now, Plab 1 and Plab 2. It will be two parts like it is right now, Plab 1. The part 1 of UKMLA would be MCQ based, and part 2 of the UKMLA would be OSCE based, which is right now the same. So to speculate, I don't think the exams will differ that much for us international graduates. I think it will be a huge different for the UK graduates themselves because they didn't have to take this exam previously. Now they will have to take this extra exam to get GMC registration. So
Okay, got it, got it. But the resources will remain same, like you mentioned, Oxford handbook and Plabable and Khalid, 1700 questions by Khalid and all of those, right?
I would say maybe there would be more emphasis on the UK based books like Oxford Handbook, just because that's what they will be teaching their own students.
yeah.
But the guidance obviously will remain the same. The GMC will probably come out with a revised blueprint of topics that they expect you to know. If you just know the topics that they expect you to know, I don't see why anyone would have any trouble.
Okay.
And doctors, like now we have just 4 minutes left. In this session, we discussed a lot of things about UK and how we can go in different, somebody who is just a fresh graduate or who has taken a break or is in done a post graduation. So, but you have given us so many new insights like this MTI as you talked about and the foundation program. That is really a good thing. But are you happy in UK?
Yes, I am. Like my friends stayed in the U.S. and they're still doing residency and they're crying because they don't get any days off. And I tell them how many days off I get, and I make them feel bad about it. But honestly, it makes a big difference because before COVID, I've been able to travel and go home and come back and it'd be normal and I can do all of these things. And my friends are like, oh, but our vacation break isn't until some very vague day in the middle of the month and they can't get days off for their birthdays. They can't get days off for studying, to do exciting conferences. I mean, we even got paid by the hospital to do an interview in another hospital because that's something that they cover. I think that's so nice. So by all means, yes. And I think happiness is obviously subjective. I know a lot of people deal with being homesick and being very far from home and not being around familiar faces. But I think it's an adventure. If you can try and settle in a new place and find the things that make you happy here, you'll always miss things. I miss a lot of things about college, and that'll never come back because that was college. But now that I'm progressed beyond college, I want to find new things that I'm sure some point down the line I'll be like, I really miss that about when I first started out. So
It's true.
Doctors, we would love to have you for another session because you are so insightful, and I think this IGTV will help. This will be saved on the IGTV, and it will help a lot of students. Who are trying to come to UK, and for me also because I might think of this as an option. You guys have really opened our minds to different opportunities of not just going back to our home country, but different places. And I think Plab is also applicable in the Middle East and Australia also. So we will get back to those questions in the next session because this is just for an hour. I mean, the live video gets over in an hour. So
All
we
right.
will have,
Okay. You take care. All right.
But thank you so much for this. When we do hope in the future, if you all want to call us again, we'll by all means do
And
so.
I think
yes, yes.
in Road to UK's Instagram that we run is basically to show that side of our traveling. Like we mostly put our photos of different places that we go
Yeah.
and visit, and our Facebook page is the main hub of information, and obviously our website is the articles and all that stuff. So if you like to see the different parts of, like, if you want to see what fun things that we do, follow us on Instagram in Road to UK, Doctors Road to UK. If you want to know in detail about a topic, we have the YouTube video that it breezes in the
It's
face,
great. It's
and
great.
it breezes mainly in the face, and I'm behind the camera most of the time. But we try to explain things in our YouTube video, and I know that articles are sometimes get too lengthy, and it's really sometimes difficult to comprehend. So, but still, if you read it multiple times and try to understand what we're trying to give you the information, we write these articles we're taking a lot amount of time and gathering a lot of information together. And we're recently asking our colleagues that has been settled in the UK to write articles for their perspective as well. So
Oh,
we have
that's nice.
doctors from GP training who wrote an article about how it's like to work in the gynae department as a GP trainee, or even overall gynae department. So it's all coming together in Road to UK website, and I hope all the aspirants who have watched this live video will get helped from the things that we do, and what you guys are doing are also great. They're
Yeah,
giving the opportunity for the medical
Individuals
students
to
and individuals to actually know. Yeah, that's really great.
Yeah.
Yeah, thank you,
Thank you so
thank you
much.
so much. We also, our medical students, we could not get a seat in our home country, so we tried our path to become a doctor, and hopefully, I mean, by any means, we just need to follow our dreams, and that is what we are
Exactly.
showcasing on our Instagram. And we love your blogs. I have read like tons of your blogs and watched the YouTube videos, even the introduction part, because it was so fun, the setting that you were in. Uh, I do have one last question. It is like out of the context. I mean, not in the series, but hopefully students will listen to this. A lot of people, they stop after giving Plab, and they do not consider going for the PG exams in the UK. Why is that so? Is the exam hard? Is that the reason, or the salary is good and people are just well settled and they do not want to enhance their degree? I mean, what is
Yeah.
the reason?
So it's actually kind of a mix of both, I would say. Some people, if they've come with a considerable gap or with a lot of experience back home and they've already reached middle age and they don't want to deal with exams any further, which is completely fair, they don't, and that's all right. They can take a trust grade or a non-training job. They still get a good salary. And there's an extra opportunity to do extra work for extra pay. It's called locum work. So for instance, in our hospital, let's say right now, if somebody called in sick and they need somebody to cover a shift, they will pay us about, how many times is it?
About 3 or 4
Three
times.
or four times our normal pay to cover that shift. So some people will, if they get to that level, they don't want any responsibility. They just want to be called in when somebody gets sick.
Yeah.
Right.
Basic experience, and they will take the basic job. They're not doing a consultant job. They're not doing a registrar job. They're just doing the normal work. But if it's something that's comfortable for them, we know some people that do that, and they're fine with that. They have time for their families. They have time to travel and do whatever they want, and they have no responsibility.
It's called, in the UK, it's called locum life. So some doctors, even the UK graduates, they decide that I don't want to pursue any further training or any further exams or anything. I just want to work and earn and live a life. So they can do that as well. So that's a very nice thing about how you want to do and how you want to make your career. If you're like, I don't want to take any postgraduate exams and I just want to work every day and earn the money, and I'm happy with it, you can choose that as well. So it's not like that.
There's no stigma.
So there's no stigma
if
that
you want.
everybody will be like, oh, you're not progressing.
Okay.
I chose not to.
Yeah.
You know what I mean? So
Okay.
so that's the thing. It's not like that the exams are hard or anything. It's just a personal choice.
Okay, great. But we can clear the exams, right? It won't be that difficult.
Yeah. There's no reason you don't, if you don't think you can always take it the next time. There's no one that's gonna. I mean, they have so many opportunities here, preparatory courses, even within the hospital itself, within the postgraduate medical center, to make sure that you are doing what you need to do in order to pass the exams.
Great.
Okay.
And IMGs do get jobs easily, or
Yeah. So doctors are on shortage occupancy right now. That means they are literally begging doctors to come and work because they need so many doctors. They've even removed all the restrictions related to training programs. So like in the US with residencies, you can't apply for certain residency programs if they do not sponsor visas. But that's not something in the UK. You can apply for anything. If you want to apply for trauma and orthopedics or neurosurgery, by all means apply for it. There's no IMG friendly. It's everything is for IMGs.
Exactly.
great.
Thank you so much.
Yeah, we'll have a lot of discussion maybe in the next time. If you ever get time, we'll hold another
Sure.
session. Thank you so much. Have a
Thanks.
great day and
Goodbye.
bye.
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 Bye.